Great. I hear my voice echoing, which is really strange with the second computer. But anyway, thank you so much for being here tonight. Is that distracting? Yeah, okay. Let's see.
Oh,
This one?
that makes.
Dave to the rescue. Better? Nope, still echoing. Test, test. Test, test. You got it? Still recording me? Yeah, I recorded. Mm-hmm. Yeah. Mm.
Sorry. Is there a volume control on that?
He
No,
fixed it.
The sound's fine.
Yeah, that he fixed it.
But it's just, not going into.
Yeah, it looks good on the screen. It's perfect. Mm-hmm. You got it.
This is.
It's fine. It's fine. As long as it's fine for Teresa, that's all I care about.
It's not gonna, it doesn't move. She doesn't see it. That one doesn't move.
Yeah.
That one's not gonna do anything.
Good up on the screen. Yeah.
But it's not sharing. So I can get it to share.
So you have to go into Zoom. Tell it to share again.
Yeah.
Oh. Perfect. Thank you. Good.
No,
Okay, everybody. I think we're in business now. Thank you so much for coming to the November Neighborhood Health Series. How many of you are new to the Neighborhood Health Series and this is your first time here? Just a quick show of hands. Okay, there are a lot of new people. Great. It's so nice to have you. Thank you so much. This is the 9th year of the Neighborhood Health Series. And it's one of my favorite things that I get to do as part of my job because it's all about sharing some of the incredible knowledge and intelligence that we have within Roseman University with our community. And I am so proud of this group because what they do is so very valuable to all of us. It's been personally valuable to me and helping my mom through Medicare. And this is a very complex subject matter. So again, I'm so grateful for everybody to be here and all of you to be here and learning with us. In December, we have our happy and healthy holidays. So we hope you join us. And there are flyers at the front. So also, if you would like to see our next upcoming January through June schedule, that's all settled and ready. So please take a flyer for that. I am recording today, and that's because we like to post these for folks that weren't able to come on the Neighborhood Health Series website. So please know that we are recording. And if you have a question, we typically like you to hold it till the end if that's possible, because these guys have worked really hard to cover a lot of those content areas. And if you do have a question, I'm going to need to get the mic to you, because if you don't have this mic, then the recording cannot hear you. So just be patient for us to scramble over and give you the mic real quick. So with that, I just wanted to introduce and welcome Clark County Credit Union. This is Craig Fraley, and Clark County Credit Union has been a partner with us for about 7 years in really helping make sure that this event is successful and it all goes according to plan. And he gets to invite all of his base and his folks to come as well. And with that, I'm going to turn it over to Craig real quick.
I'm just kidding. Good evening. We are the Medical Field Credit Union. We are very proud to sponsor Roseman's Neighborhood Health Series. And just to give you a little information about the credit union, first of all, there's some magazines out there and these cards here. Anybody, even though we're state chartered for the medical field, anybody can join. We're not for profit. We're owned by our membership. At the end of the year, we give all the profits back to our members in the form of a bonus dividend. And if you ever have an allergic reaction to banks, we're the cure for that. So make sure you come to us. And if you join, you can join online or over the phone. We do have 6 full service branches throughout the valley. You can use them all. But to join, you can join online or over the phone. Use the code MAGIC. I really am magic. Use the code MAGIC. We'll put in the first $50 into your account. So take one of those cards on your way out. Enjoy your presentation this evening and have a great Thanksgiving.
Real quick, I'd like to introduce those folks that are here helping us tonight. Okay, Molly Jordan, class of 2025. Molly's from Nevada and chose pharmacy school because she knew she wanted to help people. She was a pharmacy tech since graduating from high school and realized pharmacists are one of the most easily accessible healthcare professionals and ones that can really impact people's health and lives. All of our folks that are here tonight are from our College of Pharmacy and are training to be pharmacists. Memory Kane, there she is, class of 2025. Memory is from Chicago, Illinois. She chose pharmacy school because she enjoys helping people obtain optimal health care. Charlene Tan, class of 2025. Charlene is from Hawaii and is in pharmacy school because she wants to be an accessible resource to people beyond medications, but in life circumstances as well. Roy Franco, class of 2026. Roy is from Hawaii and his PharmD is the point of his PharmD is to serve as part of the healthcare team dedicated to get people healthier. Angelique, class of 2026. Angelique is in the PharmD program because after working in a restaurant and hospitality business, the hospitality business for 25 years, she wants to help people in a more meaningful and substantial way. Christian Valencia, class of 2026, is from Corona, California, and is getting his PharmD because of his passion for pharmaceutical sciences. Wayne Young has worked in the Roseman call center since inception. Prior to his life with Medicare counseling, Wayne was singing and acting on stage. In fact, if you rummage through old photo albums, you may find him in some of the pictures flying around with Princess Jasmine on a magic carpet. And last but not least, the mother of the Medicare Call Lab, Teresa Rawlins, has helped lead the Medicare Call Lab to new heights in the past 3 years. She grew up in Virginia and currently enjoys wearing many, many hats of MAP counselor, grandma, and youth teacher. Please join me in welcoming the Medicare Call Lab folks.
I'm on, right? Okay. We're so glad to be here with you tonight. We spend a lot of time in the Medicare call center answering questions about Medicare and eliminating confusion. So we really appreciate any opportunity to educate and teach the correct principles about Medicare. And so we're very glad to be here and share this tonight in a little bit of a unique format. I want to also acknowledge Dr. Michelle Hahn and Dr. Leanna Oswald that are here, who are here in the center. They are the faculty advisors for the call center that we get to lay claim to. Also, we are grateful to have the support to be able to be here tonight from Clark County Credit Union. So thanks for allowing us to be able to do that. So we began, I wasn't even a part of this at this point, but in 2016, the Medicare Roseman University of Health Sciences Call Center began. And this was 10 years after Part D was instituted with Medicare. So when you look back at that happening in 2006, there had been a lot of frustration among pharmacists, I understand, and that was solved when Dr. Oswald became aware of a program through one of her technicians called SHIP, the State Health Insurance Program. And he was someone who was aware of that. And so she and others instituted the call center to be able to happen at Roseman. And so that was 7 years ago. Now, here are some of our counselors today. Whoops, that bar is right over our titles. Okay, probably won't stay the same. So these volunteers have prepared extensively in order to be able to give you the knowledge tonight, but also to answer the calls that they do. What they do is prepare by doing about 30 hours of didactic training on line before they then attend a 2-day training at Roseman that's taught by Wayne and myself, state approved curriculum. And then following that 30 plus 10 hours, then they shadow for another extensive number of hours in the call center, listening to experienced callers take calls and then preparing as well for that to happen. So this is another picture of us in the call center. And we've learned through these years of having this that it's particularly helpful to have pharmacists in this call center, because many of the times that people encounter Medicare problems or things with their Part D that are difficult happens at the pharmacy counter. And so when these pharmacists have that Medicare background, then they're often able to send the beneficiaries to the right solutions and eliminate the confusion then and there at the pharmacy counter. So it's great for that healthcare professional for that to happen there. Now in Nevada, the program called Medicare Assistance Program, or MAP, it's a big umbrella for 3 other programs. And our counselors are going to tell you about the 3 programs that it's an umbrella for.
Okay, so the first component of MAP is SHIP. As Teresa mentioned, it stands for State Health Insurance Assistance Program. Every state has a SHIP. So if someone were to ask us, are you a SHIP counselor? Our answer would be yes. SHIP involves providing unbiased counseling regarding providing basic Medicare information to beneficiaries, helping to compare plans, and even helping enroll beneficiaries in plans.
The second portion of the umbrella is the SMP, which stands for Senior Medicare Patrol. And what that portion does is encourage and empowers Medicare beneficiaries to prevent, detect, and report fraud and abuse. What we want you to know is to protect your card with your heart. Guard your card with your heart. Your red, white, and blue card, guard it with your heart.
All right, and then the final component of MAP is the Medicare Improvements for Patients and Providers Act. This is also known as MIPA. This provides Medicare beneficiaries with low-income information as well as application assistance for cost savings programs.
Thank you. So that's a summary of MAP in Nevada. Now, just some general things about Medicare, a quick overview. Remember the number 65 because it's mostly for people 65 and older. We'll talk about the other populations. It was started in 1965, and at this point, it's covering over 65 million people in the United States. So in Nevada, it's about 500,000 people over that. And fun fact, we're in the 58th year of Medicare. As I said, it was implemented in 1965. Does anybody know what the life expectancy was in 1965 when President Johnson started Medicare? It was around there. As I looked it up, in 65, it was age 70. So 67 for men and 74, 73 for women. So average of 70. So things have changed a lot since then. But these are your, all these great numbers of people are your family members and your neighbors. Okay, Charlene's going to tell us a little bit about the basic eligibility.
So a large population of Medicare beneficiaries are eligible due to age, being age 65 or older. You must be a U.S. citizen or permanent legal resident of the U.S. for at least 5 years. And Part A will be granted to you if you've worked 10 years into the Social Security system, paying into FICA. That's equal to about 40 credits. And if this doesn't apply to you, if you are married to someone for 10 years, even if you're divorced to that person who has worked into the system and paying into FICA, then you would also be eligible for Medicare in that way.
Thank you.
Beneficiaries who are under the age of 65 are only eligible for Medicare benefits coverage if they have collected Social Security benefits for 24 months. On their 25th payment, then they will become eligible to receive those benefits.
So those are the individuals that are eligible for Medicare, the large population. There's a couple other exceptions, but mostly it's those populations. And Molly's going to tell us about the time to sign up.
So you have a total of a 7-month period. 3 of those months are before you turn 65, and this is the most ideal time to ensure that you're covered starting the first month of your birthday month. And then you have your birthday month, and then 3 months after you turn 65.
Thank you. We're going to give this a test. We're going to have a call come into the call center and see if these individuals can answer somebody's question about their eligibility. For example,
Medicare Assistance Program, Memory speaking. How can I help you?
Hi, my name is Roy, and I know it's November, but I turned 65 in April. I'm also collecting my Social Security income already, so I just wanted to know when exactly I can sign up for Medicare.
Of course, Roy. For initial enrollment, there's a 7-month time frame that you may sign up. With an April birthday, you can sign up earliest in January and the latest in July. Let me explain what you need to know.
okay, and we're abbreviating some of these calls, but you get an idea of the answers that callers would get. Okay, so that was Roy with a 65th birthday. Let's have another call.
Medicare Assistance Program, this is Charlene. How may I help you?
Hi, this is Christian. I started receiving Social Security disability not too long ago. When can I receive that?
I can definitely help you answer that question about SSDI. Once you've been receiving Social Security disability income for 24 months, then you will be eligible for Medicare. There will be a 7-month period around that Medicare start date in which we can help you sign up for a plan. So around that time, feel free to give us a call and we can help you.
Okay, so we heard about the 65th birthday scenario. We heard about the disability scenario, and both of those scenarios had that 7-month period that we talked about, 3 months before the month and 3 months after the month. Let's hear another situation.
Medicare Assistance Program, this is Molly. How can I help you?
Hi, my name is Angelique. I turned 65 3 years ago, but no one ever told me what I needed to do with Medicare. What should I do now?
Sure, I'd be happy to explain that to you. I just have a question for you. Have you been working or had insurance in the past three years?
Okay, I'm going to interrupt her right there. Molly has asked a really important question of Angelique, and we learned that Angelique didn't know she was supposed to sign up when she was 65 and 3 years have passed. So she has asked her if she was working or not. Now, we're going to go back for a second. We're going to hold that situation with Molly and Angelique and go back to Roy and Christian, where their card was automatically sent to them. They both mentioned that they'd been receiving Social Security benefits already, Social Security or SSDI. So that card just came in the mail to them. So that's what happens when you're already receiving benefits. If that's not the case, and you're not collecting Social Security, then the responsibility is on you to take action. So this is a reminder of the ways that you take that action. 3 months before you turn 65, then you either call Social Security or you go online on ssa.gov or you visit the office in person. Because if you don't, there could be potential penalties. So that's something that's why Molly asked that question of Angelique. Because if you still have active coverage from an employer, then you're okay. The government requirement is that you have credible coverage. So if you're working and you're covered and you have insurance for your health, then that's your choice. You can talk to the HR department and continue with their insurance, and defer or delay your Part B. You just have to pay attention to the fact that active coverage doesn't include those ones there, retiree coverage, COBRA, VA, and so forth. So that's a conversation to have with your employer, because different employers make it either primary or secondary, depending on the size of the company that you work for as well. Okay, we're going to go back to that call and see what Angelique's answer is. When Molly asked her the question about working, because it's relevant to the scenario.
Medicare Assistance Program, this is Molly. How can I help you?
So I turned 65 3 years ago, and I don't know what to do now for Medicare.
So let me just ask you a question. Have you been working or had additional insurance in the past 3 years?
I have. I carry and pay for creditable insurance through my job. It covers medical and medications.
Great. Well, that's good to hear. Just make sure you keep all the paperwork that shows that you've had active coverage for the past 3 years. Once you're ready to stop working, just go ahead and let Social Security know, and that's when you can start your Medicare. Give us a call after you contact Social Security, and we'd be happy to guide you through your plan's options.
Okay, so that's when we as counselors breathe a sigh of relief that yes, she was covered and we don't have to deliver the bad news about the penalty. So in that case, she was covered, and she can prove that she had credible coverage because yes, she was working. And I just am going to throw in one other fact about that for those of you that are still employed. If you're donating to a health savings account, or your employer is donating to a health savings account, that's a scenario while you're working when you would want to delay your Medicare, possibly your A and your B. So again, that's a conversation to have with your HR department, because there can be potential tax penalties if you don't have a 6-month gap between starting Medicare and those donations that are happening from your employer or to the health savings account. So the other thing to consider when you're deciding, I'm working and I'm covered, but Medicare is available to me now because I've turned 65, is that it's not free. So here are the costs. It's $174.70 a month starting in 2024. And then there's a $240 deductible for the year. So there's the total you see that happens before you even get any services for Part B. So that's where you would crunch numbers and see, do I want my employer's plan at the cost I'm paying them, or am I eager to be on Medicare? And that's an individual decision. So we're going to go back to that call and see what happens if the answer is different. What if that individual was not working?
So Angelique, have you been working and had other insurance in the past 3 years?
No, I haven't, and I haven't worked in a long time. And then I really didn't know I was supposed to do something with Medicare.
Well, we do want to help you out and get this sorted out, so I'm glad you called. I do need to let you know that the government could assess a penalty for the time period that you were eligible to receive Medicare when you turned 65 until now.
Oh, no, how much is the penalty? I don't have a lot of money.
In your situation, it looks like it's going to be about $50 a month that you'll have to pay for the rest of your life. There could be some assistance programs that you could be eligible for. So do you mind if I ask you some additional questions?
Okay, then we'll pause that call there. These calls take minimum 45 minutes, sometimes 90 minutes. So we're giving you abbreviated versions of this. But in that scenario where she wasn't working and she'd missed the 3 years, so then a penalty does come into play. And that penalty, there's a formula that is based on how long you were, since you were 65 and at what point you've realized you were supposed to be on that. And we can help advise about that too. Okay, so now having helped Angelique at least freeze her penalty and only have it stop at $50 and not go another year, which would increase the penalty. We're grateful that she called and we were able to help her with that. Here now at this point, we're just going to really briefly go over the parts of Medicare. A for hospital, B for medical, and D for drugs. And the counselors will share a little bit about that with you as well.
So when you think of Part A of Medicare, think admitted, being admitted into a hospital. It also includes skilled nursing facilities, hospice care, and home health care.
So when you think about Medicare Part B, think about basic medical services, like when you visit your doctor or have outpatient services. It includes preventative services such as immunizations. It also includes home health care and durable medical equipment such as nebulizers and diabetic testing strips.
Part D is your prescription drug programs. So for this one, you have to have either Part A and or Part B to be eligible to receive Part B or Part D, I'm sorry. And the drug coverage and costs do vary per plan, so just be aware of that.
Okay, so they have talked to you about the 3 parts of Medicare. And what we tell people all the time is there are 3 parts of Medicare, but there are 2 ways to obtain those 3 parts. So you see one schematic on the left and another schematic on the right. And that's a big decision. If you're going to do original Medicare or you're going to do an Advantage plan. And we're going to talk about those choices. Let's have the Medicare call center give us some answers to those who are choosing that. Roy and Angelique are faced with ways to obtain that.
So from my life situation, it's just to get original Medicare, and a separate Part D drug coverage plan. So I found this card, my red one card at the doctor's office, and then I'll show this card at the pharmacy.
And for the recording, if that wasn't heard on the tape, Roy is making the decision between these 2 choices, and he chose original Medicare. So he's got the Part D separate as a separate card from his original Medicare card. Thanks, Roy. Let's see what Angelique chose.
I decided that an Advantage plan was best for me. I still have my red, white, and blue card, which I keep safe at home. But when I go to the doctor's office or the pharmacy, I show them my Advantage plan card. And this works just as my original Medicare card.
That's one of the thanks, Angelique. That's one of the things we spend a lot of time helping people understand is what card covers what. And so that's just demonstrating that for you. But back to those 2 choices, it's a big decision. So we're going to talk just a little bit about how you would decide about which way to go between those choices. And we say there's a few ways to think about that. Health is one of them.
Yeah, health is an important factor in making this decision between original Medicare and a Medicare Advantage plan. Let's say you see a lot of different specialists for your health needs. If you wanted to get an Advantage plan, you want to be sure that all of the specialists and all the doctors that you want to see are in that network of that plan.
Thank you, Charlene.
Cost is another important factor in the decision. You will most certainly pay more when you have original Medicare. You will most likely have to purchase a supplemental coverage, which comes with an additional cost. But with the original Medicare, you do have more room or more freedom to see whichever provider you like. But you do have to consider the additional cost.
Thanks, Memory.
An example of how lifestyle can affect this decision is if you live in different parts of the country during the year, then your doctor network does need to allow for that.
Thank you. Here I'll emphasize that Medicare is always individual. If you've been used to a family plan or couple plan, Medicare is always individual. So even in a married situation, you may have different plans because your health is different, your medications are different. So this is a chart that helps us review that big decision between the 2 things. So we'll just go through some of the things that are important to consider. In original Medicare, that's the government. That's a government plan providing your health care directly. Whereas in an Advantage plan, that's the private insurance companies. So you're talking about United Healthcare or Humana or Anthem or Aetna. And we're unbiased in our counseling with you, but that's a private insurance company providing that for you. As far as providers with original Medicare, like Roy chose, with the red, white, and blue card, and then a separate standalone Part D plan, you can see pretty much any provider. Just about everybody accepts Medicare assignment. That's the term for when they will accept your Medicare card. And you can go directly to a specialist. Whereas on an Advantage plan, you have to be careful that you're staying in network to that insurance plan's network, or they're not going to pay for it. And also, Advantage plans require that you get a referral from your primary care before you see a specialist. So a little bit more that you're considering there. As far as the premium, yes, you're going to pay it, the $174.70 on original Medicare. On an Advantage plan, yes, you're going to pay it. Some plans will give you a little bit of a buyback, so sometimes it can be less. D coverage, you always need to add that. That's a requirement to your original Medicare. In an Advantage plan, it's wrapped together. The A and the B and the D are wrapped together, called C. And then supplemental insurance, yes, that's very important to consider, but not with Advantage. It's illegal. You would not have an Advantage plan and a Medigap policy together. They are separate. These are 3 types of Advantage plans. So just a reminder that there's different terminology with Advantage plans. An Advantage plan can be an HMO or a PPO or a special needs plan. All of those are in the Advantage plan category, orchestrated by a private insurance company. So this is highlighted here because we haven't yet talked about the Medigap coverage. And that's an important part of the scenario when you've got original Medicare. If you do not have that coverage, then you are paying 20%. Remember, Medicare does not pay 100%, it pays 80%. So without Medigap supplemental coverage, you're looking at paying 20% of any medical bills, and every hospital stay, your deductible would be $1,632 in 2024. So that's something we advise about. We didn't yet tell Roy about that, so we're going to make sure that Roy knows about that as he inquires with our call center again.
So I know that I have original Medicare. I'm on the hook for the 20%, and that could be a big number. Can you tell me more about that?
Yes, of course, I can tell you about that. There are supplemental policies that are also known as Medigaps that can help cover those additional potential medical costs. You would pay a separate insurance company a monthly premium, and then you can get that secondary coverage after Medicare.
Roy, we also want to let you know there are 3 types of Medigap policies, so you save money. There's attain age, issue age, and community rated. Most policies are attain aged, meaning they increase in price as you grow older. We advise you to look at the other 2 types of plans as they are more steady in price over time.
Lastly, we just want to let you know that Nevada now does have a new law that allows you to change your Medigap policy. You can change it on your birthday month of each year. So if you do choose to change your Medigap policy, you do have that opportunity.
Thank you so much. That's what I'm gonna do. Make it a Medicare for the 20. My original Medicare, and then also my Part D separate coverage plan.
Okay, thank you, Roy. Again, sometimes people are confused about all those cards in their wallets. So that's why we're illustrating that way. And we take a fair amount of calls explaining about these separate kinds of policies for Medigaps, because not everyone's aware of that. And that's a new law. We've only had that new law in Nevada since the January of 2022. So we're happy to explain more about that to you. But before we leave Medigaps, this is a really important scenario. I actually had a call just today before I came with someone that didn't know about getting a supplemental policy when she was 65. And so there's 2 times in your life when you can get a supplemental policy without doing underwriting. You're welcome to pay for and obtain one at any time, but you will be asked about your health history, and that will have to be disclosed, and they can decide how much they're going to charge you for the policy, or if they don't even want to insure you because of your pre-existing conditions. But 6 months after you've turned 65 and the first 6 months after you've taken Part B, if you decided to defer your Part B beyond your 65th birthday, you have 6 months when they legally cannot ask about your health history. So that's important to consider. In Nevada, the current law is that anybody in the disabled population that has Medicare cannot obtain supplemental policy. So their choice is only to be on Advantage plans. Okay. Just a review, we've pretty much covered, this is the original Medicare choice. Those things I think you're probably familiar with from the things that we've said, which cards you're carrying for which, and that no vision, dental, or hearing is offered. And this is then a Medicare Advantage plan summary, staying within the network, going to the primary care to get referrals. And we hadn't mentioned that there's a yearly limit on out-of-pocket expenses. So many of the HMOs cap your out-of-pocket expenses at $1,000. So you would know on an Advantage plan, no matter what happened to you, health-wise at $1,000, or they vary, $2,500, depending on the plan, then they will come in and pay for 100% of whatever else you need to know. So definitely the more affordable option if that meets your lifestyle. And they are supposed to cover all services that original Medicare covers. And they often throw in vision benefits, dental, and hearing. And you're just carrying one card for all your health needs. So that's just a review of that. Let's go back to the call center for another call about more Medicare questions.
Medicare Call Center, Memory speaking. How may I help you? That is true. Original Medicare does not cover vision, dental, or hearing. However, Medicare Advantage does offer some basic services.
Memory's going to explain that there's also preventative services, a great deal of them.
I can talk with you more about what is and what is not covered. Medicare.gov is a great place to read and learn about these differences. You should know that Medicare covers over 30 preventative services, which is listed here. Thank
So
you.
we just emphasize to take advantage of those because the preventive services are free. Okay. We've got another call coming in to the call center.
Medicare Assistance Program, this is Molly. How can I help you?
Hi, I was told that Medicare Part B is gonna cost $165 a month, but I'm looking at my statement now, and I got charged $350. Can you tell me why that is?
Sure, I'd be happy to explain that to you. So $164.90 is the base premium. However, do you happen to make more than $97,000 a year? If so, IRMA might be applied to you. IRMA is the name for an extra charge that is applied to those that make more money. It increases your Part B and your D premiums.
Okay, yes, I do make more than that. Thank you. Also, I've heard about the donut hole. That term, can you explain the donut hole to me?
Of course, a simple way to say it is when a Medicare and their plan have spent, a Medicare beneficiary, I'm sorry, and their plan have spent $5,030 on covered medications, the beneficiary enters what's called the donut hole. During this phase, Medicare beneficiaries' costs is maintained at 25% for both generic and brand name drugs. When the cost reaches $8,000, the beneficiary transitions into what's called the catastrophic coverage phase. Once in this phase, starting in January, the Medicare beneficiary will pay nothing. If you'd like, I can help you open up an account on Medicare.gov and you would be able to see how this coverage gap would affect your personal medications.
I would love that. Thank you.
Molly mentioned Medicare.gov in her answer, and we'll be spending some time. We'll go live onto Medicare.gov to answer some of your questions there in just a few minutes. Now, besides answering basic questions about Medicare and IRMA and what A covers and what B covers and what's preventative, one of the things that we spend a lot of time in the call center doing is offering assistance programs, because we have a knowledge of them. We're trained of when to point beneficiaries to those programs. And so when you have friends and neighbors that are in that situation, you're welcome to have them call us as well. There's two different scenarios. There's both state help and federal help, and we'll go through these fairly quickly, but the state assists beneficiaries with low income in two ways. One way is paying their Part B premium, and the other way is if their income is even lower, below $1,225 a month, and their resources are low, under $9,000, then the state pays everything after Medicare pays. So that's a Medi-Medi situation, and they get that kind of assistance. So that's a big deal. Then the federal assistance is called Extra Help Program, and federal assistance has a little bit of a higher cap. And so when your resources are under $13,000 and your monthly income's under $1,800, then you can have credit towards your Part D premium, as well as reducing significantly the cost of medications. Generics on $450, these are 2024 prices, and brand names only at $11, no matter if it was a $500 drug for those people in that income situation. Okay, we're going to see a scenario of people that are in this situation, theoretically.
Medicare call center member speaking. How may I help you?
Hi, I'm so confused. I was told that you could help, but I'm also told to go to welfare. I don't make a whole lot of money. I can't pay these premiums and pay all this Medicare cost. And in addition to that, I take Xarelto now, which is so expensive. What do I do? Can you help?
Of course, I can help you with that, Wayne. If you're able to tell me your monthly income, I can give you information about a couple of programs, the MABIT program, as well as the Extra Help program. I'm going to explain to you both, and with your permission, I can get that application in for you.
Okay, so I'm going to zoom through this conversation because this would take a while, but we're going to learn that his income from Social Security is $1,290 a month, that his resources are under the $9,000. He already told us he's taking Xarelto. So this is the plan he happens to be on with SilverScript right now, $1,240 premium, and that he's only got that one drug theoretically. So his cost each year is $1,900. So Memory will enroll him in Extra Help. That we do that application then and there, and that will take away the $1,240 premium and reduce the cost of the Xarelto significantly, as we just said. So there are his savings with the year on Extra Help. Additionally, because his income meets the state qualifications, she will direct him to the welfare department, where he'll be able to qualify for his monthly Part B premium to be paid. And so he will have a great savings. I'll let her deliver that news to him.
Wayne,
Still here.
guess what? Now that we've successfully gotten both of these programs in place for you, you'll save $3,874 this year.
That is so amazing. Thank you. This will help my family and myself so much.
Goodbye.
Good job, Memory. Okay, but many people make more money than those low income qualifications. And so is there any hope for them to save money during the year? Let's look at this scenario. Let's hear from Angelique.
Medicare Assistance Program, this is Molly. How can I help you?
Hi, I got a letter saying that my premium is going to increase. Do you have any suggestions for me?
Sure. Would you like me to do a plan comparison for you in Medicare.gov?
That would be amazing.
Okay, again, I'm going to interrupt and fast forward. So she currently has a program. We're unbiased, so I'm not going to name names here, but that's the one you can see from her premium is in 2024 would be $110.70 a month. Is there anything better than that? Yes, by changing plans, her premium could go to $12.40 a month. These are real screenshots from Medicare.gov. So with that one drug that we learned that she was on, was it Eliquis? Yeah, then she is going to be able to save. So just by changing plans, we also take a look at the pharmacy. That's an important thing to understand. The drugs are the same in this scenario. All she is changing is the plan that's administering her Part D coverage, or possibly changing the pharmacy. That's one of the conversations I had today with a couple that called me. There's a certain plan that's doubling its premium for next year. And so I've been changing a lot of people from that plan. So I'll let that news be delivered to Angelique.
Angelique, it looks like if we switch you to a different prescription drug plan for 2024, looks like you will save about $407.
Wow, why wouldn't I want to do that? Thanks so much for your help.
So that's another thing to be aware of. You might want to look at, will there be quantity limits or things like that before you do make that switch? But that's an important savings. Now, because we are able to do that beneficiary by beneficiary by beneficiary, in the time that our call center has existed at Roseman, we've saved beneficiaries. Actually, since I made this slide, we went to 2.4 today. Just in September and October, it's been just September and October, it's been $180,000 of savings during open enrollment. So that's pretty exciting because that, in some cases, that's people's food on their tables, and healthcare, you know, is very expensive. So we're very proud of this over the 7 years. But it is not all about the money. We are very proud to be able to listen one at a time to the beneficiaries that call us, and we'll hear from our counselors what is rewarding to them about being a part of this.
With all of the skills that I've learned from being a Medicare counselor, I've actually been able to help my family members quite a bit. During this time of open enrollment, my aunt was a representative to 2 Medicare beneficiaries. They were her in-laws. One of them was on Medicare because of disability. The other was on Medicare due to age. And so they were part of the same family. They had completely different healthcare needs, but they both wanted to know advantage plans that could meet their needs. And also another fact about another thing on top of that is that in my family, English is not their first language. So I was able to figure out ways to communicate how to get their Medicaid benefits transferred, how to navigate Medicare.gov once I opened an account for them, and help them submit their applications, like their extra help application on their behalf. And it was really insightful to not just help them save money and get them the plan that they need, but it was also just really rewarding to learn about how I can communicate such complex information about Medicare to my own family and help them.
One of my most memorable experiences was while working in a call center. A beneficiary called and she needed help she needed help with affordable medications. So we were able to search Medicare.gov for her and find an affordable plan. And she also wanted to stick with her particular doctor. So not only did we search for an affordable plan for her, but we also looked up doctors to make sure that it was covered in her Advantage plan. That way she can stick with her doctor and she can still be able to see her doctor and get the necessary medicines that she needed. Also, we were able to switch pharmacies for her. So she was very grateful and the experience was rewarding.
Medicare is such a broad and complex topic that any call that I can help a beneficiary kind of navigate their own way through Medicare is just really rewarding to me. I think all of us need to be our own, advocates and stuff. And I think that doing the MAP counseling and everything, that really helps, encourage people to be their own advocate with Medicare.
Thank you. I had one experience last year. It's one of my favorite callbacks that I've had after counseling someone, because I had said, I mean, I often give homework. Okay, I can tell you this, but you're going to need to go do this, and you're going to need to do this, and then you'll be able to reap the benefits of the advice I'm giving you. So then I had a voicemail where she said, Teresa, everything you told me, it worked. and now I'm, now I won't have to pay so much money. So that was very rewarding. At this point, we'd like to give credit to, give credit to Dignity. That's who our grant sponsor is right now, and has been for the last 3 years through grant funding to sponsor our Medicare call center. And they have their motto of human kindness. And we really have been able to take that to heart in our call center, because we do a lot of listening, and it's not always about Medicare, either a lot of listening about situations. And so we're grateful for that funding. Every call we end, before we end, we give what's called the Senior Medicare Patrol message. And so we remind them for the things you see on this screen. We don't want anybody experiencing identity theft. And sometimes people are not careful enough with that private health insurance information. So we're always reminding beneficiaries to look at their Medicare summary notices, to know that Medicare doesn't cold call you, and that you need to keep your Medicare card in a safe place like you would your credit card. So here are our contact numbers. You are welcome to call us with any questions. We know you may have questions here today, but before we go to questions, we're just going to do a demo on Medicare.gov so you can see exactly what it looks like when we're working through it. So we will escape out of this and pull up the internet. So if you go to Medicare.gov, G-O-V for government, then okay. Should we do it on this computer?
No, just share the talk.
Okay, I think it works. Okay. So she's going to pull up Medicare.gov, and you'll be able to see what that interface is like. And you would be able to put in your own information once you're 65 and you have your Medicare number. We're going to continue without logging in and just show you the general interface. It's all zip code based. So Charlene's going to put in the zip code for here, and we will compare plans. This is a general place where you can have a lot of questions answered about what Medicare covers and what it doesn't cover. But just for your own interest, we'll put in as if we were putting somebody's plan in. So we will input some medications. She's putting in the zip code, and we're going to first start with the Medicare drug plan. And it's going to ask us if we want to put our drugs in. Well, of course we do, because that's one of the whole points of this. So we'll get to where she's going through the different steps like you would. Yes, we do want to see our drug costs. And so then we will put in some medications. You all can volunteer some medications. Let's put in 3. What one would you like to see? Yes.
Trilogy Ellipta.
Okay. There's a quick fill for when you put in the medications. You just make sure you're being accurate with the dosage and with the quantity and the dosage. And so that one's there. Yes. What one would you like? Jardiance 25. These pharmacy students are fast at inputting these drugs. They know them. They're faster than I am. Okay. Did you already get in? Okay, one more. It usually defaults to the most common dosage. I'm assuming. I'm not a pharmacist. Okay, so then there's the opportunity to put in several different pharmacies, and we usually put in the big retail ones, or they will let us know if they have a specific preference that they want to know. And mail order is always a competitor too. And so we routinely just check 5, it gives you the ability to compare 5 at a time. And so there we go. Then you say done. And it will automatically sort by the lowest drug plus premium cost. And remember, we said we were going to look for a prescription drug plan. So it's thinking and will give us the results in the zip code that we put. Okay, so WellCare is a prescription drug plan that for 2024 has a $0 premium. There are 2 for 2024 in Nevada. And so that I've been talking to people who said that can't be right. And it is. That's how they're competing this year. So there's those 3 drugs. Go ahead and go to plan details, Charlene, and we'll see. It's automatically showing you the lowest pharmacy. Today the website was, there we go. Okay, so that's a yearly cost. For all of 2024, those 3 medications would cost you the $3,055. And then as she scrolls down, it'll show you month by month what you're looking at each pharmacy. It'll show you which pharmacies are preferred or if it's not even in the network. So here, that's the total cost of the 3 drugs for the whole year. Or then the next screen will show you the total each month. Well, it also will tell you when you're going to enter the coverage gap. So March or April, you're going to hit that coverage gap. And then there's your monthly cost, depending on which pharmacy. Scroll down just a little bit more so we can see the pharmacies again. Okay, so you're able to see the pharmacies versus that. Any questions about this while we have this up? If she could also do a plan compared to the next plan, if you want to back out. It's pretty straightforward with a drug plan. You're just really looking at cost. But if she backs out, you can do a side-by-side of one prescription drug plan beside another prescription drug plan. So that is just add to compare, and it'll let her compare 3 at a time. Why don't you just do the first 2? So that tool allows you to do a side-by-side. One plan is a 3.5-star plan. The other one's a 2.5-star plan. So this is assuming you're on the original Medicare and you want a standalone prescription drug plan. Let's say you had those 3 drugs and you wanted to consider an Advantage plan because you couldn't afford a supplemental or something. So let's back out, Charlene, and we'll go to an Advantage plan. It has you, as you go through this process, sometimes it's repetitive, but it'll have you choose, do you want an Advantage plan or do you want a prescription drug plan? Over and over, it kind of reminds you again that those are the choices. So we will change it to Advantage plan. Going to ask which one we want. And then there's a little more to look at on the Advantage plans because they offer things like gym membership and transportation. And so when it pulls up the first one, we'll see the lowest cost. Again, we're working with the same pharmacies unless we want to change that. And you can input how far you want to drive to go to a different pharmacy. But once this loads, then you'll be able to see a big green check by the things it does offer and a big red X by what it doesn't offer. There's a lot of people on Medicare.gov during open enrollment. Today I was having trouble that just was calculating. So until December 7th, it's gonna still have a lot of hits. Okay, so scan is the first choice for those 3 drugs, has no premium. Most of the Advantage plans don't have an additional premium in addition to your Part B. that you're already paying. So the yearly cost for that is 2,200. And there you can see the checks and the X's for what it has and what it doesn't have. So then if you'll just go to plan details on the Advantage plan, Charlene. So now, unlike the drug plan, here you'll be able to see what's your primary care doctor's copay going to be? What's your specialist doctor's copay going to be? How much are you going to pay for x-rays? How much are you going to pay for labs? And so that's all available, and you can put it in a side-by-side with the second best Advantage plan. But the most important thing with an Advantage plan to consider is, do you have providers that you want to be loyal to? And are those providers accepting that plan or not? So that's yes, we can take questions. We're gonna give you the mic. 1 sec.
I also think it's good to know that one of the benefits that I found in dealing with a mail order pharmacy, like Centerwell Pharmacy, is that my copays, like for the Eliquis, was so high that they allowed me to make a payment plan.
Oh, okay.
Because if I just went to CVS, you know, the copay was like $1,400 when I started.
Okay.
But I was with Centerwell, and I actually asked, and I said, well, do you have a payment plan? They said yes. And so they would break it up for me. I'd have to put something down that day, and they break it up. And then by the time I finished paying, I got to do it all over again. But oh well.
But good to
I
know.
just think it's good to know.
Right,
because
that is good to
people
know.
don't talk about that.
Thank you. Question here, but just wait for the mic. Hang on. Just to allow our viewers at home to hear the questions.
So these Advantage plans, like this one says it has no fee. So in other words, you don't pay
No premium, no
No
monthly
premium.
premium.
no
Okay.
monthly premium. You only pay what you're already paying for Medicare?
You pay your Part B premium that's you're either paying or it's already coming out of your Social Security benefits. But then you're going to pay $90 if you go to the ER. You're not going to pay at urgent care. You're not going to pay for x-rays. This is plan specific, the one we're looking at right
Right.
now. There's usually an urgent care charge on other plans. But it'll tell you exactly the percentages you will pay for different.
So in other words, they
Care.
get the money from Medicare that you're already paying for your Part B plan. Okay, thank
Yes.
you. Because we had friends tell us, oh, they pay nothing. And I'm saying, but I'm paying because we don't make the minimum amount of money. So I'm saying we're not, we're paying from Medicare a lot of money, and how could,
Right.
I was afraid that this wouldn't be zero because they would be hitting us up for more money besides what we're.
So the Part B premium is the $174.70, or if you're dealing with an
you're right.
IRMA
We're in an
situation, then that's going up whether you're on original Medicare or whether you're on an Advantage plan. That's your choice. Okay, another question.
Hi, I have twofold question.
Uh-huh.
With regards to this website, if I'm not Medicare yet, but I just want to get to know numbers for my own medication or for my family's
right.
medication, can I use this?
Right, because she's not in anybody's account right now. You do exactly what she did. You put in a zip code, you check continue without logging in, and then you play around with whatever medications that you're interested in, what the cost would be. That's totally available to you.
Regardless of whether I'm Medicare or not.
Right, because you won't be able to create your own account. You don't have a Medicare number yet, but Medicare.gov is a site that answers a lot of questions and can explore a lot of things.
Perfect. And then my second comment is kudos to, is this Roseman
Mhm.
call center?
Roseman, call center.
Very, very
Underneath the MAP
impressed.
program.
I'm very
Yes.
impressed. How does one become a counselor? Because I'd like to learn more about being a
Awesome,
Medicare
awesome.
counselor.
We have cards. I'll have you take a card and you can find out more about going through the training. Yeah, we'd love to have you. We're always recruiting volunteers. Thanks for offering.
Any other questions?
Mine is a long question.
As long as it's general. If it's
let's
specific,
say-
we're gonna say call us.
Let's say I turn 65. I get the white, red, and blue card.
Hmm.
I apply for Medicare Advantage. I get it. But a year later, I decide to go back to work.
Okay.
I don't want to keep it anymore because with the place I was hired, they offer me insurance. And should I call the Social Security and let them know I don't need the Part B anymore? And what are the consequences if I go back to get it a year later?
Okay, and thank you. Before I answer your question, you reminded me, I didn't delineate the thing that it's not a one-time choice of going original Medicare or Advantage plan. You can do one and then go back to the other. Just remember about that guaranteed issue right. If you chose Advantage plan first and then you decide original Medicare, you will have lost your opportunity to have those supplemental and the guaranteed issue right. So the requirement is that you have coverage from the government. So if you go back to work, you could have a primary, secondary situation, still pay and be having the works as well if you want to be doubly covered. Or I believe you can also defer your Part B, telling them you'll pick it back up again when you are not working again.
Are there any consequences or fees or penalties for doing that?
Just the 67 days once you stop working to pick back up your Medicare, right? 62, 67. There's like a short window when you stop working to get back onto Medicare.
Exactly. It's 8 months to get Part B. You have 8 months after you stop working and get Part B, but only 63 days to get Part D. So,
Thank you.
great question. Did you have more you wanted to add to that, Wayne?
No.
Okay.
Sort of similar.
Okay.
I have a lady that she is in great health. She's 72.
She's in great health.
Yes.
Okay.
Never been to the doctor, doesn't go, doesn't take any meds. She still works.
Mhm.
She never applied. She didn't even know she had Part A. She doesn't know she has Medicare, nothing. She doesn't go to the doctor, nothing at all. She's still working. She doesn't have any type of medical insurance.
You say
And-
she's working and doesn't have medical
Doesn't,
insurance.
she never applied, she never got it, nothing. Now
Okay.
she wants to get it, and then she told me that they denied her to get Part B. And then somehow her son told her to go back to work and talk to HR and get medical insurance through them.
We can definitely talk about the specifics of that, but the principle here is if you haven't had coverage, you're going to be charged a penalty back to the time of 65 when the government said you were supposed to get it. And it's a 10% penalty, 10% of the cost of the Part B premium. So about $17.50 for every 12-month period that you didn't have the coverage. And you will pay that every month for the rest of your life. We all have our personal choices and the consequences of those personal choices.
If I can just add something really quick, the only thing that I think in these two scenarios, the thing to remember are the entities. Medicare is separate than Social Security. Social Security is the agency, is the entity that controls the enrollment of Medicare. So in his scenario where they were asking about going back to work and choosing whether or not to continue paying for Medicare as a additional or a secondary, or whether to just stop it completely and then re-enroll later when their coverage ends with the employer, is all done through Social Security, not Medicare. So those are Social Security would be the correct entity in order to find out those answers. In his scenario again, he would have the ability to be able to return back to work, stop the Part B payments, just remembering that it's up to the beneficiary to be able to provide the proof that they had credible coverage to return back to Part B so that there is no penalty assessed like in the second scenario. But all of this is done through Social Security, not Medicare. That's all I wanted to add.
I know from my own parents that are on Medicare, how often when people call in for the drug plans or for the Advantage plans, would you end up recommending a change to a plan? Because I know in my parents, they're very loyal to their plan and they don't want to go away from the plan. But it sounds like there can be a lot of advantages to doing a check like this every single year. Is that right?
There's definitely advantages. We really encourage you to do it yourself. You can come in here yourself with your own login and do that. You can even change the plan yourself and enroll yourself. So definitely with a prescription drug plan. With Advantage plans, definitely check because they can drop providers at the start of a year. They can take drugs off their formulary. Well, so can the prescription drug plans, but definitely do a yearly check. Once you're happy with an Advantage plan and you know your providers are accepting that Advantage plan, then that's a conversation to have. How much money are you going to save, but lose Dr. Smith, who you really appreciate going to? So then that there's some more decisions to make there as well.
After you have been on Advantage plan and you want to go back to the original Medicare with supplement, how hard is it to get back to it?
That depends on how your health is. You would have to go through the underwriting unless you had had a supplemental originally and you wanted to try an Advantage plan. You are allowed to freeze, suspend your supplemental to try out an Advantage plan. It's called exercising your trial right. Tell them, I'm not dropping you. Tell your supplemental, I'm not dropping you, but freeze this and try out an Advantage plan. You have a year to decide if you are okay with the restrictions they put on you for the, to the tune of saving more money or not. And then you can go back. That's what our training says. I had a beneficiary tell me that an agent told them otherwise. So that would be a question for your supplemental.
It's very confusing.
Yes.
The information that you receive on the mail, on the calls and everything. There are Advantage plan that is saying that they are non-profit, and they give a benefit all free, and even outside of the country, but only for emergency. Okay. But I found out that most of the plans cover the emergency, situation if you're out of the country. But you still have to pay, outright your fee or the charge that they have in that circumstances, and then you claim it when you come back home. And that for sure, you would need to have a good record that you are going to bring home to justify those.
Right. Every time I do an enrollment, part of the paragraph that we read says, you understand that Medicare does not cover care outside of the country, only limited coverage near the US border. So yeah, this is the United States that we're talking about. If you're going foreign, then Advantage plan, sometimes, yeah, I would say you're on your own with foreign, with insurance. This is a United States plan.
You were about to say something about those for-profit Advantage or non-profit Advantage. Is there anyone?
I was just going to say, take any of that advertising with a grain of salt.
Yes.
Read the fine print,
Okay,
and
good.
yeah, they hype it and make it seem the best, and yeah, it's not necessarily all it's cracked up to be.
Anyone else?
Other questions?
Can we give a big round of applause for our students? Teresa, Rawlins, and Wayne. The Academy Award goes to Wayne tonight. Okay. Thank you all for coming. We hope to see you in December. We really appreciate you being here.
Yeah, that's fine. Thank you. Unless you, yeah.
Is this nationwide?
A SHIP program. Every state has the state health insurance program. So you would Google what's, Oklahoma's SHIP. Here it's called MAP, but yes, every state has an advisory program to help people navigate it.
Because it doesn't
So
seem that way. calling the government, it's like pulling teeth.
Right,
So
right.
there were specific choices.
Exactly.
Right here.
Right, exactly. Yep, yep.
Thank you so
And there's
much.
literature